Idiopathic scoliosis has long resisted a clear explanation of its cause. This video introduces a non-invasive, integrated approach to treating it, the Hyun-Ga Manual Technique, or HGMT, together with the JESU5C classification system built upon it. JESU5C was developed by Dr. Young-Sub Lee, building on HGMT, which was originally created by Dr. Soo-Hyun Kim. Together, their work unites Western biomechanics and Eastern meridian theory into a single clinical framework. HGMT begins from what might be called a Glocal view of the body, treating it as one integrated system. At the macro level, the spine is understood as a primitive teguque structure, biomechanically divided by the diaphragm. At the micro level, even a minor subluxation at a distal joint, such as the wrist or ankle, can influence the entire body. An input at the fingertips, in other words, can travel through the shoulder and pelvis to reshape the whole spine. Correcting a local area, then, always requires attention to whole body balance. The first principle, Jongdong, is the exchange of stability and mobility. In standard kinesiology, the trunk serves as the anchor while the limb moves. HGMT reverses this relationship. A joint in the limb becomes the anchor, and the spine itself becomes the segment that moves. The pathway for this force is the meridian sinew. Isometric resistance exercises along these sinews send the resulting vector to the transport points on the back and the alarm points on the abdomen, correcting spinal alignment. The second principle, one gun, is the distal proximal vector law. Contacting a distal point, the ankle or wrist, produces a wide vector range, while suited to severe curvatures. Contacting a proximal point, the knee or elbow, concentrates the vector for precise, segmental correction. Clinicians choose between distal and proximal contact points depending on curvature severity and the specific correction targeted. Diagnosis begins with 5 Hyun-Ga Axis lines on X-ray. Line 1, the gravity line formed by the conception and governor vessels, runs from the spinous processes to the pubic symphysis and is the most critical of the 5. Lines 2 through 5 map to the kidney, stomach, spleen, and gallbladder meridians. Notably, severe curvature without distortion of line 1 often causes no pain, so the goal is aligning line 1, not forcing a perfectly straight spine. Building on this, Dr. Lee classified scoliosis into 6 geometric patterns: J, epsilon, S, under, 5, 5, and C. These patterns are dynamic. A J pattern often evolves into a 5 or S pattern, and each has a mirrored, reverse counterpart, yielding 12 clinical profiles that allow individualized treatment. Applying this classification follows a 4-step radiographic protocol: box drawing, marking the boundaries of the thoracic cage and pelvis; HGA line plotting, mapping the 5 axis lines onto the image; subluxation mapping, locating displaced vertebral segments; and pattern identification, the final classification. Together, these steps give clinicians a reproducible diagnostic standard, rather than relying on subjective judgment. Lower body correction accounts for a substantial share of clinical practice. Roughly 80% of HGMT is performed in the supine position, using ankle and knee contacts to correct anterior, posterior, and lateral deviations of the lumbar spine. Contacting SP5 on the spleen meridian, for instance, shifts the vector toward the 2nd and 3rd lumbar segments and the abdomen, while contacting K-I2 on the kidney meridian focuses the vector strictly on the lower lumbar vertebrae. The meridian selected, in other words, determines with real precision which segment becomes the target. Upper body correction demands an even more refined approach. The GB39 technique, on the gallbladder meridian, is central to correcting lumbar rotation and is especially effective for rotational J-pattern cases. The PC7 technique, by contrast, corrects the thoracic spine directly through overhead arm extension. Because wrist-based corrections involve force vectors running in multiple directions, they require an exceptional level of precision. Alongside clinical technique, HGMT includes a system of meridian-based isometric exercises that patients can practice at home. These standardized protocols rely on the maximal extension and contraction of the meridian sinews, organized into categories such as meridian flow optimization, structural integrity maintenance, cervical rotation, and shoulder abduction. Through this self-directed practice, patients maintain and reinforce the corrections achieved in the clinic as part of daily life. These principles extend, as well, into a wearable device, the JESU5C Pattern Suit, designed separately for the J pattern and the S pattern. Using lines 200, 300, and 400 running from the limbs into the trunk, the suit reproduces HGMT's isometric vectors continuously over a full 24 hours. Unlike conventional rigid braces, which rely on uniform pressure, this patent-pending suit delivers targeted, directional isometric force calibrated to each patient's specific classification. These principles are supported, too, by clinical cases. In an S-pattern case, correcting line 1 of the Hyun-Ga Axis restored the gravity line, alongside improved structural balance and reduced pain. In a C-pattern case, correcting the axis normalized internal organ position and likewise reduced pain, suggesting that correcting spinal alignment may restore organ function as well as musculoskeletal balance. In conclusion, scoliosis should be understood not as a localized spinal deformity, but as a systemic biomechanical and neurological imbalance affecting the whole body. By integrating Eastern meridian mapping with Western kinesiology through this Glocal perspective, HGMT offers a scalable, non-invasive path toward whole-body synchronization, resting on 3 pillars: meridian theory, isometric biomechanics, and wearable technology, such as the pattern suit. As Nobel laureate Roger Sperry observed, much of the stimulation reaching the brain originates from spinal movement, which is why treating scoliosis may open a gateway to neurological health as well. To explore JESU5C and HGMT in greater depth, the full clinical framework is presented in the author's book, available on Amazon. For the complete picture, the author's professional background, publications, and ongoing research, please visit scoliosis.tel.